Dentistry, transforming your health for a lifetime.
Good morning. You are listening to Complete Health with Dr. Mike Rogers. I'm April, Office Manager at Complete Health Dentistry. Today we're talking with Dr. Brad Bale about vascular health celebrating Men's Health Month. Dr. Bale is a heart attack and stroke prevention specialist. He's the co-founder of the Bale-Deneen Method for Heart Attack and Stroke Prevention and co-author of the book Beat the Heart Attack Gene. He is also an adjunct professor at Texas Tech University Health Science Center School of Nursing and the medical director at the Heart Health Program at Grace Clinic. Dr. Bale is also co-author of numerous publications in peer-reviewed medical journals and other medical publications. Good morning, Dr. Bale.
Good morning, Brad. How are you today?
I'm fine, Mike. How about you?
Fantastic. You and Amy both had co-authored an internationally profound study on indicating that 50% of heart attacks and strokes are caused by the bacteria in the mouth. Can you discuss the study a little bit and give us how you came up with that figure and just elaborate a little bit more on that?
Yeah, well, the paper that we actually published stated that high-risk periodontal pathogens are causal of arterial disease, and they're a contributory cause. And we were able to publish that in a medical journal based on the fact that there are three essential elements necessary to form disease in the wall of the artery. And we demonstrated in the paper how all of the high-risk periodontal pathogens contribute to each one of those elements in an adverse manner. And the only conclusion you can make when you realize that is that those pathogens are a contributory cause. So what that means, a good analogy to think of with that concept is like driving under the influence. There's no question in the United States today there will be some automobile accidents due to driving under the influence. There's also no question there'll be a lot of accidents that occur today that had nothing to do with driving under the influence. And it's also true there'll be some people who drive under the influence and luck out and they don't have an accident. So that's the type of causation we're talking about. Periodontal disease is extremely common. We know once a person's 30 years of age, 50% approximately of people have periodontal disease. Once people are above 65 in age, it's almost 80% of those people will have some periodontal disease. So it's a very common problem, and it is the pathogens that drive the arterial risk. So the public needs to see an oral health care provider, a dentist, a hygienist who's familiar with all of this science and who knows how to run the sophisticated testing to show what bugs, what germs are actually involved in the periodontal disease. And if any of those high-risk pathogens are involved, obviously it's imperative to eradicate those infections in order to make sure you keep healthy arteries.
So what you're saying is people with periodontal disease are likely to have arterial disease, just like driving under the influence is likely to cause accidents. So to avoid periodontal disease, see your dentist, preferably one trained in the Bale-Deneen method, to take care of your gum disease and avoid arterial or heart disease.
Now, as a medical professional, not being a dentist, can you just look in someone's mouth and just say, hey, you do have a gum problem or you don't have a gum problem? Or if, and then can a patient just look in the mouth or a person just look in the mouth? And
yeah, that's a great question, and the answer is both yes and no. If somebody has horrible disease, you can look in there and you'll see real inflamed areas of the gum tissue all around the teeth, and if you touch them, they'll bleed. So some people have the disease so bad that you can actually see it. But a lot of people, I would conjecture to say the majority of people who have these high-risk pathogens, you're not going to be able to just simply look at their mouth and be able to determine that they're there. So it takes DNA testing that can be done either from saliva or a deeper pocket around the tooth can be sampled, or even the dorsum of the tongue can be scraped. So there are different ways you can get samples from the mouth to look for these bacteria. And then cultures are not reliable in the mouth. We just have way too many germs. But what is reliable is DNA testing.
Dr. Bale, is this DNA testing something that you do in your office, or is this something that can only be done in a dental office?
That's a great question. I don't do it. I actually legally could, but I'm a medical provider. I'm not a dentist, so I don't know how to treat periodontal disease. I don't know how to treat the bacteria if I find them. So I always send my patients to an oral health care provider, a dentist, hygienist that is familiar with all of this science, who can do the testing. And then if the patient has high-risk pathogens, they know how to deal with it.
So if I'm hearing you correctly, to combat arterial problems, heart attacks, strokes, you partner with a dentist that's especially trained to treat the patient
absolutely.
Together. So it's not a one or the other thing, it's working together. Well, the exciting thing here is right here in Wayne County in Honesdale, Dr. Rogers does practice the way that you've been discussing. We do complete health, and we do offer the DNA testing in our office, and our entire team is versed on that. And we've had many success stories in helping our patients lead a healthier life.
Right, and one of the things that my partner, Dr. Doneen, and I are trying to get established throughout the country and eventually throughout the world is to make sure every community has a collaborative team of medical and dental providers. And when I say dental, again, it's not just the dentist. The hygienists are the ones that are really going in there and usually treating this periodontal disease. So they need a supportive dentist who, of course, understands the science and supports their work. But keep in mind, when I say dental provider, I'm also including the hygienist, and really it even goes beyond that, because you want that office, all of the personnel in there, to be familiar with the science and understand how critical it is to do that type of sophisticated testing, and then to manage any pathogens that are found. So you even want the receptionist in the dental office to understand this science, so that when the patient's leaving and the receptionist looks at what's occurred that day, they're going to look at the patient and say, wow, hopefully you realize how lucky you are to be in this practice, because they understand the critical importance of periodontal disease and the sophisticated testing in terms of arterial disease and risk for heart attack and stroke.
You are listening to Complete Health with Dr. Mike Rogers. We are here today with Dr. Brad Bale discussing men's health. When we come back, we will continue our discussion. Hi, this is April from Complete Health Dentistry. Did you know dental insurance was created back in 1954 with $1,000 a year maximum? Sound familiar? That's because those maximums are still in effect today, 60 years later. While inflation increased, dental coverage has not. Although you may be tempted to make decisions about your dental care based on insurance, remember that your health is the most important thing. At Complete Health Dentistry, we do everything we can to help maximize your insurance and minimize your out-of-pocket expenses. We are pleased to announce that we now participate in several insurance plans provided by local businesses. We welcome employees of Woodlock, Wayne Memorial Hospital, Suburban Propane, FedEx, Lowe's, and St. Mary's Villa. Call 253-5000 and schedule your new patient experience today.
Complete Health Dentistry, transforming your health for a lifetime.
Good morning. You are listening to Complete Health with Dr. Mike Rogers. Today we're talking with Dr. Brad Bale about vascular health celebrating Men's Health Month.
What prompted you as a family practitioner to focus on heart attack, stroke, and diabetes? And what prompted you there then? What made you say, hey, I want to go in and prevent this and start to reverse it, see if we can work people out of going down that path?
Yeah, that's a great question. Well, first of all, I started family practice back in 1975. It was quite a few years ago. And after about 20 years of doing family practice, I had my share of patients who suffered heart attacks and strokes. So I took it personally, and I was fortunate to be practicing in Spokane, Washington, where there was a cardiologist who was way ahead of his time, Dr. Paul Shields, where he taught that it's inflammation that actually causes arterial disease, and that it's a blood clot that blocks the flow of blood, not the gradual buildup of cholesterol in the wall of his artery. And one of his partners had actually published that paper in the New England Journal of Medicine in 1985. And his message was really simple. He said, look, you do this test on a patient and they have a positive score, you know for sure they have disease in the coronary arteries. So you should treat them, because it's not the amount of disease there that causes the heart attack or the stroke if it's in the brain. It's the degree of inflammation. And if it's even a small amount of disease, but it gets inflamed enough that it ruptures into the flow of blood, that patient's going to get a big clot. So if you have a positive score on that test, you should treat them. And I got started because I realized you could detect asymptomatic, silent, but potentially deadly, dangerous disease in the coronary arteries by simply looking to see, do they have calcification in those arteries. So that's how it all got started.
When I take an x-ray called a panorex, it goes around the head, some patients I can see calcifications in their carotid arteries. Is that what that coronary calcium test is doing, is kind of taking an x-ray of the heart to see if there's calcium around the heart?
Right, yeah, and any time you see calcium in an artery, it proves beyond really almost any potential doubt that the patient definitely has disease in the wall of their artery. And if they have disease in the wall of their artery, they are at risk for dying from cardiovascular disease, having a heart attack, having a stroke. And we also know that over time, they have much greater risk for developing dementia, heart failure, kidney failure, losing some of their intestines due to arterial disease, getting peripheral arterial disease where they might need an amputation. And one thing men certainly need to know is they're going to usually develop erectile dysfunction. The most common cause for erectile dysfunction is arterial disease. And when a man develops arterial inflammation, it's as predictive for a heart attack down the road as having an abnormal stress test. So it's a huge predictor. And any men that develop erectile dysfunction absolutely need to be evaluated for arterial disease. But yeah, when you see that calcium on your panarex in the carotid artery, we know for sure those patients carry substantial risk for a stroke over the next 5 to 6 years, and they should be sent to a medical provider who understands that and knows how to evaluate the patient with our acronym EDFROG.
Could you go into what that is?
So that means educating them, looking for disease, evaluating biomarkers for fire, looking at all the potential reasons they could have fire in the artery, optimally managing all of those issues that aren't optimal, and anchoring the work in genetics so you can be precise with your advice. One of our medical colleagues who does our method actually turned our acronym EDFROG into a verb. So she says she loves EDFROGing people.
You are listening to Complete Health with Dr. Mike Rogers. We are here today with Dr. Brad Bale discussing men's health. When we come back, we will continue our discussion. Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry. Transforming your health for a lifetime.
Good morning. You are listening to Complete Health with Dr. Mike Rogers. Today we're talking with Dr. Brad Bale about vascular health, celebrating Men's Health Month.
We check everybody's blood pressure in our office every time they come in, and we constantly get the question, well, why do you do that? Well, one, we do it for screening because we're using anesthetics that could elevate blood pressure. But is there an ideal blood pressure that our listeners should strive for? And is it just small changes in blood pressure, does that affect significantly? Meaning, like if blood pressure is supposed to be, say, 120 over 80, and I'm up at 135 over 86 or something like that, is that a big deal?
Yeah, no, it's a big deal. But again, you have to look at the individual patient before you make any hard advice on where their blood pressure should be. But for somebody who doesn't have any significant arterial disease that's in any way obstructing, you can make the argument, an ideal blood pressure definitely would be under 120 over 80. And as it rises above that, risk for numerous things increases. And one of the ones that we believe is most significant is the brain. Because our patients, we want them to live long, but we want them to live with good quality of life. I think hopefully everybody would agree. If you're 90 years old and you don't even know where you are or who your relatives are, is that a good quality of life? I don't think so. And dementia is on the rise big time, as is Alzheimer's. And we know they're strongly related to the blood pressure. They published a study about a year and a half ago that we believe is definitive. They looked at 4.2 to 8 million people ranging in age from 35 to 85. They followed them for 7 years to see the impact of the blood pressure on going on to develop dementia and Alzheimer's. And it was a continuous relationship. The higher the blood pressure, the higher the risk. The only comfort at all was once the top number went below 120, as it kept going lower, yes, the risk did continue to go down, but it was getting to be a pretty flat line. Once it goes above 120, the line for increased risk of dementia and Alzheimer's gets pretty steep. So from a brain perspective, we feel comfortable if we keep our patients' blood pressure under 120. Now, there are exceptions where we don't want to get it that low. If patients have really obstructing disease in the wall of their artery already, either in the heart or the brain, and you lower that top number under 120, you potentially could lower the bottom number, the diastolic number, so low it could be harmful to the patient, because it's that bottom number that really feeds the heart. So when the heart squeezes, that's the high pressure number, the systolic. The heart can't feed itself when it's squeezing. It's when it relaxes and fills back up with blood that it feeds itself, and that's the lower blood pressure. So if the patient has really terrible disease in their arteries that is blocking some flow of blood, and you lower it too much, you might actually kill them.
Oh.
And so it's a real individual thing with blood pressure, but if you have a basically, quote, healthy person, doesn't have any obstructing arterial disease, you can certainly argue ideal blood pressure is under 120 over 80.
In your book, there's 10 ways that you can boost your heart health. Make sure you're sleeping at least 6 hours a night. Dark chocolate. Physical activity, 22 to 30 minutes a day. Get rid of your belly fat. Avoid sugary drinks. Increase your fiber. Relax. Avoid smoke and secondhand smoke. And the flu shot. Most listeners may look at and say, well, why does dark chocolate help?
The dark chocolate, yeah, there's tons of publications out, and they've been coming out now for probably at least 15 years that unequivocally tell us dark chocolate is enriched with certain flavonoids that'll clobber the risk of heart attack and stroke, lower blood pressure. One of the studies showed if you eat it as an appetizer, it even reduces the big surge we get in blood sugar. So the literature is full of excellent studies to back up the use of dark chocolate as a way to stay healthy. And when we say dark, really we prefer 85% or greater dark. When you're that high a percentage, there's hardly any sugar in.
Why should I avoid sugary drinks?
Sugar increases the risk of going on to develop diabetes, that insulin-resistant condition, which is one of the biggest reasons the arteries will get on fire, because a huge percentage of Americans now are pre-diabetic and insulin-resistant, and one of the reasons they consume these refined carbohydrates, and that's why we recommend against sugar-enhanced beverages.
So, Dr. Bale, as we wrap things up here, are there any questions that I should be asking or men should be asking their physicians when they go in for their yearly physical, or any specific tests that they should be asking for?
Yeah, I'd ask them if they've been trained in the Bale method. Do you know how to head frog somebody? And if they don't, I'd be looking for somebody who does. We're trying to get more and more medical providers trained.
So unfortunately, if they don't have a physician available to them that's been trained in this method, is there anything that they can specifically ask for?
It's really a tough question, because if you request a test from the doctor and the doctor really doesn't know what it means, doesn't understand the science behind it, they very well may say, oh, yeah, sure, I'll order it for you. You may have to pay for it, but I'll order it for you. So then it comes back abnormal. What are you going to do? If the doctor doesn't normally measure it, doesn't know how to deal with it, and you're not a medical provider, it's really could cause harm, actually, in my opinion.
Is there a
to
place...
request a test from the doctor where he's not comfortable with it, he doesn't understand the science behind it, I don't think it's a good idea.
Okay.
Again, everything good in life comes from education. What we should be concentrating on is educating more healthcare providers in what we talked about today.
So if I want to
unfortunately, a lot of healthcare providers, let's face it, they use the insurance company as their default medical expert. And that's a shame, because the insurance companies are not medical experts, and they lag at least 30 years behind the science. They're still paying for stress tests in asymptomatic people to see if they're at risk for a heart attack. Now, how wise is that? Good night.
So if I want to go to a physician that's trained in the Bale-Deneen method, do you have, is there a website? Is there a way that I can find a physician that's trained?
Yes, on our website we have a map of the United States. We do designate providers that have taken our course, and then some of them have even gone further, and they work very closely with us. And if that's the case, they have a special designation. If they have that designation, you can be quite certain you'll get a good EdFrogging from them.
So as a patient, you can go to baledeneen.com to find that physician locator. What if you're a physician and you say, you know what, there's more to my practice than, and they feel like you felt 30 some odd years ago, where your patients are your family, and there's more that you feel you can do to help them. Where could they go to the same site and figure out how to become someone trained in systemic inflammation or total body inflammation?
Yeah, great. Yeah, absolutely. They go to our website. Our book has done so well that the public demand for the Bale-Deneen method has now exceeded how many medical providers we have out there who can do the method. And on our website, we also have dentists.
Dr. Bale, thank you very much for everything you've given us and our listeners today. I appreciate all the great work that you do. I mean, you certainly are a mentor of mine. And I'd love to have you back somewhere in the future, and I always enjoy talking to you.
Well, thanks, Mike. Yeah, I mean, it's an exciting age that we live in now, because we do believe nobody needs to suffer a heart attack or stroke. We now have the technology and the knowledge to shut them all down, but the person has to want to do it, and a patient certainly has to be compliant with the advice that you're given if that's going to happen. But it is exciting. Heart attacks and strokes do not need to be on the top of the billboard any longer for killing us and disabling us. So it's exciting. I feel blessed to be able to do what I do. But thanks for having me on your show and getting some of this message out to the public, because the public is the one that'll drive the change. Believe me, it's not going to come internally from healthcare providers. It'll be the public that demands that a change be made and we move onto this prevention platform. So thanks for giving me the opportunity to reach out to some of the public with this information. Appreciate it.
Thank you, sir. You have a great day.
Okay, you too.